Right, good morning and welcome everyone. I hope everyone is staying safe and doing well. My name is Akshara Gopalan and I'm a policy associate at JPAL. I work with the gender sector. Today we're here to have a discussion about gender-based violence, and we have an incredible panel assembled and I'll introduce them shortly. We'll start off the webinar by having each of the panelists talk a little bit about their work in the area. We'll then move on to a discussion session and then end with a Q&A for which you can submit your questions. According to the World Health Organization, 1 in 3 women globally reported experiencing intimate partner violence, and this was prior to the pandemic. While violence against women has always been a very pressing and important issue, it might have been worsened by the COVID-19 pandemic, perhaps due to restrictions on mobility placed by lockdown, etc. So in fact, recent data released by UN Women, for example, shows an increase in calls to domestic violence helplines in several countries. Our panelists today will talk about findings from their research on how the pandemic has been affecting violence against women and through what pathways. In addition to examining this, I think we're also hoping to provide some perspective on how donors and practitioners are grappling with challenges related to addressing gender-based violence in this situation. This webinar is jointly organized by JPAL and the Center for Global Development. Megan O'Donnell, who's from CGD, is one of our panelists and will provide some details on the very interesting and important work that CGD is doing at this time. At JPAL, we've been undertaking some synthesis of evidence from randomized evaluation on intimate partner violence. If you can share the slide, please. I'm waiting for the slide to be shared. I'm not sure if you can see it. There you go. Perfect. Yeah. So we produced a literature review at JPAL last year on women's agency and approaches to increasing women's agency. And this review contains a section on intimate partner violence. If you could just click the next. Here are some example takeaways from this. Firstly, we found that 5 studies showed that cash and food transfers while in place decreased intimate partner violence in the short run. These studies were from Ecuador, Bangladesh, South Africa, and Kenya. I do want to flag that cash transfers and food transfers might affect certain subsets of women differently. So there's a need to focus on vulnerable populations. We also found in many studies of various different kinds of gender training and couples dialogues, sometimes combined with economic programming. These were in many cases successful in reducing intimate partner violence, but of course, like I mentioned, programming varied widely, and these were spread over several countries in South Asia and Sub-Saharan Africa. Can we move to the next slide, please? Great. We've also at JPAL, through the Crime and Violence Initiative, funded some interesting studies recently at the intersection of the COVID-19 pandemic and gender-based violence. If you can click the next, thank you. Some of these studies are on the screen. Erica Field, who's on our panel today, will be able to talk about the first study in Peru, but there are also some interesting studies in Colombia and Pakistan. So that's just some of the work we're doing. I do want to acknowledge that there are several other researchers in other disciplines who've been working on this topic, and we are just hoping to add to that body of work that already exists. So without further ado, I want to introduce our panel today. Our first panelist is Diana Arango. Thank you, Diana, for joining us. She's the Senior Gender-Based Violence and Development Specialist in the World Bank Group. She has more than 10 years of experience working on development issues ranging from gender-based violence, different types of gender-based violence, and specifically within the context of humanitarian setting. She's an anthropologist by training. Our second panelist is Erica Field. Erica is an economist who currently works as the Professor of Economics and Global Health at Duke University. She's also a JPAL affiliated professor. Her research interests include development economics, labor economics, and health economics. Our third panelist is Felicia Knoll. She's the co-chair of the Lancet Commission on Gender-Based Violence and the Maltreatment of Young People, which was recently established. She's the director of the Institute of the Advanced Study of the Americas, and she's a professor at the Department of the Public Health Sciences at the Miller School of Medicine in the University of Miami. Her research focuses on global health in low and middle income countries and women and health, among several other topics. And finally, our fourth panelist is Megan O'Donnell. She's the Assistant Director of CGD's Gender Program and a Senior Policy Analyst who works on issues related to women's economic empowerment and gender data, among others. She's recently been engaged in work on COVID-19 and gender, and she will be continuing this work to ensure that policymakers and donors have the evidence they need to ensure that women have access to response efforts as well. So thank you so much to all our panelists for joining us. I'm very excited about our discussion today. I'm going to start out, like I said, with posing some questions to each panelist so they can talk a little bit about their own work. So let me start out with Megan. So early in the crisis, CGD put out a working paper tracing the pathways for gender-based violence to increase during pandemics and other crises. You can all find this paper on the CGD website. Are we seeing these historical pathways for increased incidents play out in the COVID context? And if so, how should policymakers respond? And what do we know and what do we still not know? Megan, over to you.
Thanks so much, Akshara. Thanks to my fellow panelists and to everyone joining today's discussion. Now, the paper that you just mentioned, we put that out at the beginning of April. So not long after the COVID-19 pandemic had gone global in its reach and the WHO declared it a pandemic. Now, at that stage, we were all starting to see media reports of intimate partner violence and other forms of violence against women and also children increase. But it was still too early to rely on rigorous research specific to the COVID context to confirm those media reports. So what we did in the interim is draw on historical data from other pandemics and public health emergencies, Ebola, Zika, SARS, and also other crisis contexts. But before going into the substance of the paper and how we built on it since April, I want to briefly thank my co-authors. First and foremost, huge credit and thanks to Amber Peterman at UNC Chapel Hill, and also a CGD non-resident fellow for bringing all of us together through the Gender and COVID Working Group to do this work collaboratively, as well as Alina Potts, Niyati Shaw, Kelly Thompson, Sabine Ortelt-Prigion, and Nicole Van Gelder. So it's really been a group effort. And Mike, can I ask you for the slides now? Thank you so much. Akshara, as you mentioned, the first part of the working paper we put together traced pathways through which violence against women and children can increase in pandemics and other crisis contexts. I'm not going to go through all 9 pathways in depth, but just to paint a broad picture to start us off. As many of you are likely aware, stay-at-home orders and other lockdown measures not only increase the amount of time that potential victims of violence spend in close contact with potential perpetrators, but also impose limitations on their ability to leave a violent situation, seek help from health, legal, or other frontline services, or just turn to friends and family for support and intervention. A layer onto this dynamic, the increased financial strain many households face as a result of economic downturn in pandemic context, causing mass unemployment and lost income. And we see the risk of stress and tension leading to violence within households also increase. And we also trace pathways related to school closures, seeing evidence, for example, from the Ebola context from Oriana Bandiera and co-authors that out-of-school girls were more likely to spend time with older men and then get pregnant, so suggesting a potential increase in coerced transactional sex of these minors. We see the risk of coerced sex increase as some humanitarian workers may take advantage of their positions of power, whether distributing food or vaccines, to demand sex in exchange for these essential items. And finally, we see that frontline health workers, who are disproportionately women, may be increasingly subject to violence at the hands either of those seeking medical attention or more broadly within their work contexts. So now to your question on whether we are seeing these historical pathways for increased incidents of violence play out in the COVID context. At first, what I'll say is that the rigorous evidence was pretty mixed. Amber and I, along with Tia Palermo at the University of Buffalo, put out a review back in June that mapped the research up until that point. as papers started to come out that spoke directly to whether violence was increasing or decreasing within the COVID context specifically. In the first 12 studies we reviewed, we saw 3 papers report increases, 3 report decreases, 3 report mixed results, and 3 report no changes. So pretty tough to get a murkier picture than that. But I'll note, importantly, that this was still fairly early on in the pandemic. Evidence was concentrated almost exclusively in high-income contexts, and we already had some reason to believe that where we saw underreporting, that may have been driven by, to believe that underreporting may have been driving those results where we were not seeing increases, but rather decreases or no change. So now, just out today, Amber and I have done a second review with a lot more evidence to draw on, fortunately. 18 new studies that speak to the same question, and now with more geographic diversity. So we have papers from Peru, a context I know Erica will explore in more depth in a moment, as well as Argentina, Bangladesh, Uganda, India, Mexico, in addition to those from the US, the UK, Australia, and elsewhere. And with more evidence to draw upon, we can start to say with increased confidence, based on rigorous data analysis, that COVID-19 and its associated policy response measures are driving increases in violence against women and children across contexts. And as we suspected, where mixed or decreasing trends appear, there's more emerging evidence to suggest that underreporting may in part account for those results. Overall, of the 30 studies we reviewed, 13 show increases, so that's 43%, in addition to 8 or 27% showing mixed findings, which means there's an increase in at least one measure, so 70% overall. I'll say here, though, that we still see gaps in the evidence base, perhaps not surprisingly, particularly around the prevalence and severity of violence against children, which is a population that's always difficult to study, and particularly so now related to COVID-imposed research limitations. Studies in low and middle income country contexts also could be increased, and those that seek to understand COVID's implications for violence occurring outside the home. So some of those other pathways I referred to earlier. Now, briefly to the question regarding how policymakers should respond, and in this regard, what else we still don't know. Next slide, please, Mike. Our original working paper was divided into 2 parts, with the second part focused on potential policy responses, what national and subnational, as well as donor institutions and others can do to mitigate the risk of violence in the first place and support survivors when it does occur. So you can see those listed here on the right. Now, fortunately, other organizations are working to document the policy responses that governments are coming out with in the COVID context. I know that UNDP and UN Women, for example, have been working on mapping these responses and will be launching a tracker officially reflecting them in the coming days. But in terms of what we still don't know, there's still little evidence available on the effectiveness of various policy measures within the COVID context. So the focus on this front has not yet measured up to the focus of researchers just tracking whether violence is increasing or decreasing. Amber and I, in the policy note just out today, point to what we think is a needed shift now in research that focuses just on what's happening to what do we do about it. To support policymakers and practitioners working to make decisions to support potential victims and current survivors. And Achra, as you mentioned at the top, drawing on the historical pre-COVID evidence, we see the impact that cash and in-kind food aid can play in easing the financial stresses I mentioned earlier. And with many governments mobilizing to provide these kinds of support in light of COVID, there will be opportunities to further confirm this finding. The interventions you mentioned to improve gender norms more sustainably within households are a bit trickier to start from scratch, obviously, within a crisis. But there are interventions with rigorous evaluations attached to them already underway. The World Bank's Sahel Women's Empowerment and Demographic Dividend Project and its husband schools come to mind as one opportunity to learn more about the impact of this kind of gender transformative norm approach. So I will stop there, as I know my fellow panelists will also have contributions on this front. Thank you so much. Really looking forward to hearing from everyone.
That was very interesting, very informative. Thank you so much, Megan. I want to move on to and pose a question to Felicia. The Lancet Commission on Gender-Based Violence and Maltreatment of Young People began its work just as the pandemic hit. Could you talk us through some of your research plans to better understand GBV during this pandemic, including the work you're doing to collect subnational data on the impacts of COVID-related policy responses in Mexico and Brazil, and how you plan to build on this work moving forward? Over to you, Felicia.
Of course, and thank you so much. And thank you specifically to the Center for Global Development and to JPAL, and especially for Megan, who's now really deeply involved in our commission and sharing so much of her work. And it was a challenge to prepare these comments because usually I base my comments a lot on Megan's work, but she was already sharing in this. So what I'm going to do is share a little bit with you about how our Lancet Commission is working, and then drill down onto some of the issues of COVID, but also say that, and just to start, I think we feel strongly that while the term shadow pandemic is catchy, interesting, important, that really there are two pandemics here. They may be dual in the sense that they're feeding off of each other, but there was a pandemic of gender-based violence and violence against women, violence against children before COVID hit, and it will continue afterwards. And so to bury ourselves in whether or not it's a little bit worse now than it was before is probably not the way to go. I think the question, as Megan was alluding to, is how can we build back better? I also want to thank some of my colleagues that helped prepare these notes, and particularly Dr. Bevesiu, Marieke Blofield, Julio Rosado, Reno Nargund, and a few others. And of course, my co-chair, Flavia Bustreo, who may or may not be listening, given that it's coming to the evening in Italy right now. First, why did the Lancet decide that it was a good idea to agree to a commission at this point, building on a lot of earlier work, including a phenomenal series that was published a few years ago? And we believe that it's because we're seeing this as a risk factor that affects more people than almost any other risk factor than one could think of, sort of similar to pollution in its extent. But in this case, we're speaking about a risk factor that we believe can explain many of the mals of our world, that we can, in fact, think could explain something like a gender wage gap and others. This is perhaps an instrumental reason for doing something about this. There's an underlying set of intrinsic reasons, of course, but the instrumental, we believe, is important here in getting at why it's necessary to invest more and to do more about this set of issues. So a commission gives us a chance to do this because it's a longer piece of work. It's a body of about 30 different individuals held together as commissioners, and then others that come together. So it's a different opportunity over, in this case, a 3 to 4 year period to ask what new evidence and research can we bring together. And our commission in itself, in order to do this, has to be interdisciplinary. We have a good gender balance here. More than 50% of our commissioners are originally from or living in a low and middle income country around the world, and they're spread around the different regions of the world in order to be able to give us what we hope will be a global view. We also have 2 youth commissioners to keep us in tow, and one of them is a survivor who from Rwanda, who has worked on follow-ups to commissions before. And I think those 2 individuals will help to keep us moving forward with the voice of youth, and that we feel is so important here. We also have a series of early career researchers joining us, so quite a way of expanding our reach in the work that we are able to do. Now, what is the value added here? The way that we've structured this commission is what we've called a diagonal approach. And that diagonal approach has typically been used to think about health systems in the past, that it's neither vertical nor horizontal, but it brings the best of the two together. So many of our commissioners have not worked on this topic before. They've worked on health system strengthening. They've worked on evaluation studies. They're leading epidemiologists, and they're coming together with experts on violence against women, violence against children, and gender-based violence to think about new solutions and new ways of approaching this set of issues. We also have a very strong governance, advocacy, and outreach group, and I'm very, very proud and pleased to say that that's chaired by the Honorable Helen Clark, with Dr. Flavia Bustreo, again, my co-chair. Now, what are we going to do, and how does this lead into some of the work on COVID? Because as you said, we had our first meeting exactly in March. It was supposed to be in person in London, but of course that didn't happen. So we were probably one of the first to try to figure out how to do an in-depth, lengthy meeting using Zoom, which in fact worked very well, as we've now seen around the world has worked well. We're taking a Senesque capability approach, and we're first looking at a deeper estimate of needs, building on global burden of disease, and working very closely with one of our commissioners who's at the Institute for Health Metrics and Evaluation, because we want to make sure that we have improved estimates built into what everyone in the world uses around global burden. We're looking at the long-term intergenerational costs of inaction. We know that has been tried in the past, but we feel that we're bringing some new analysis to bear on this. We're scoping out policies, programs, projects, and legal frameworks, thinking about constructing these multi-sectoral, expanded platforms and packages that are essential, but also larger, depending on the context of each country, costing these packages, developing an investment case, and thinking about what are the necessary recommendations and change that's required for global, regional, national, and subnational policy making for better governance and linking to advocates around the world. So that was how we came into our work, and then comes COVID. And we had identified a couple of areas that we felt that in addition to that sort of cross-cutting approach were especially important, and that's what I wanted to highlight here. And one of them is cyber violence. So one of our associate researchers is Marianne Franks, who's done tremendous work on this. She's also based at the University of Miami. And she was bringing this to light as an issue that has been under-discussed, that we don't have enough research, and where the policy making requires the private sector, requires a global take, and so much more needs to be done. Now, in the context of COVID-19, this issue of cyber violence, which I don't think has been spoken about enough, is extremely dangerous and increasing, of course, because we have so many people in the house working on computers, including children, and of course women, and because we know how people are bombing into meetings, taking pieces of webinars, taking information and throwing that out. So first I want to hit the issue of cyber violence. Can we do more? And can we take this as an opportunity really to do the build back better idea of let's get those policies that are so difficult, thinking about cross-border transfers in place, using as an excuse the issue of COVID-19 and how much more we're doing online. Second point, and you alluded to this in your question, is what is this idea of an observatory? And as you also mentioned, UN Women, UN University, Michelle Remy and Pascal and others are building a strong piece of work on this, and we're collaborating very closely with CGD. What we're bringing to this, and this goes back a little bit more to what I do in Mexico and through an NGO that I lead, Tomatelo Pecho, is to think about how we can pilot sub-national review of information, because we know that in a number of countries, we are simply lacking both on the health side and on the issues of gender-based violence, an appropriate national response. You know, I hate to pick on the country that I call home, which is Mexico, but there's a lot to be picked at. So having had a president stand up and say that 90% of the calls that come in from women about violence are bogus, just like the calls you get on the metro about a bomb. So saying that publicly undermines the opportunity for a national response. But then the question is, what can we do? And that's where you find the states, the city of Mexico coming in, and other municipalities around the country. What we're going to look at are both programs that are successful and those that aren't. One that we're looking at in depth, and I'll speak about it in, I think, later on in this meeting, is the Argentinian, the new program Acompañar. One that we're particularly concerned about, that we believe is being downgraded now, is one in Mexico called Cuenta 10, count to 10 if you feel that you are going to be violent, in which actually the example was a woman potentially being violent to an elderly individual. So we have to look at both the programs that are doing potential harm, as well as those that can be particularly successful, and drill down and do that, very difficult, hard work of looking at the subnational level. And that's what we're beginning to do with colleagues. And that I'll end. Thank you.
Thank you so much. It's so nice to hear about these plans, and it's exciting to see what will come out of all of this work. I'm gonna move on to Erica with a question. I know that, and like I mentioned before, you have a project in the field evaluating a program in Peru to address gender-based violence in partnership with the Ministry of Women and Vulnerable Populations in Peru. Could you talk a little bit more about how the pandemic affected the project and what you found about the rates of IPV in the area, and how the programming was altered following the onset of the pandemic?
Yes, thank you very much,
Yeah.
Shara. So let me give you a bit of background to you in the audience about what we've been doing in Peru. I really see this as certainly our research in Peru, which has been a series of program evaluations related to IPV programming by the Ministry of Women, the government's Ministry of Women, over the last couple of years, was very much affected by the pandemic, in the sense that, like in much of the world, these programs got immediately put on hold and are now being reconceptualized. The reason I see it as an opportunity is both because this allowed us to work with the populations with which the ministry had been working prior to the pandemic, which gave us the opportunity to track those households and have baseline data and follow what was happening to them with relative ease, in a situation in which it became suddenly very difficult to survey people and find people. And secondly, we've been able to work very closely with the ministry to redesign their programming. That was delayed a bit in the beginning as people were waiting to see what would happen, when would things go back to normal. But Peru, like several other countries, has been severely affected in terms of both economic and health-wise in terms of the pandemic. And so for the foreseeable future, much of the IPV programming, and I assume social programming more generally, is being re-envisioned in a more, to be delivered in a more remote fashion. And so let me ask you to put up the slides now, please. And this is joint work, I should say, with a team of colleagues and researchers that includes Jorge Aguero, who's at the University of Connecticut, Javier Romero, who's at the World Bank, and Ursula Aldana, who's at the Institute of Peruvian Studies in Lima. So next slide, please. So just to give you a sense of, as a setting for domestic violence, Peru has one of the highest rates of IPV in the world, at least as we can measure it, as best we can measure it. More than a third of women report having experienced IPV. And it's also, as I said before, a country that's been especially hit by pain. It's behind only Brazil in Latin America. There have been huge economic impacts. And also pretty extreme, ironically, also very extreme government lockdown measures from the inception of the pandemic that have not been particularly successful in containing. And also a lot of geographic variation across the country in terms of the lockdown measures that are being undertaken by municipalities. Next slide. And we have some evidence. This is a study by my colleague who's part of our research team, Jorge Aguero, just tracking rates of reporting on the domestic violence hotline, Línea 100, which shows a very clear correlation with the timing of the pandemic and the number of calls to the hotline. So there's suggestive evidence that, as we would expect, these huge economic impacts and lockdown measures, some combination of the two, have been associated with a big increase in domestic violence. Now, there's some ambiguity when you see these numbers, because certainly people's ability to reach out to social networks, to other forms of help, have also fallen as they enter lockdown. And so there's some possibility that this increase in hotline reporting is a switching behavior from other forms of support to this one particular phone support. But again, we have reason to believe that domestic violence itself and all forms of domestic violence, but especially perhaps IPV, is increasing. Next slide. And so what we've been trying to do, as I said, is twofold. First, we're trying to get some empirical evidence on the degree to which rates of IPV have changed as a result of the pandemic. Although I completely agree that is not necessarily the priority. There was a huge issue of domestic violence prior to the pandemic, and there will be going forward. But that's why the second objective of our research is particularly exciting, which is, what kind of alternative policies can we implement in this setting to tackle this problem? And I think it's something that I see as an opportunity also because these forms of programs may be particularly scalable, even in non-pandemic times. Although it's certainly something that we have a lot to learn about. So we're engaged also in working with the Ministry of Women to design a text messaging campaign targeted to men, which focuses on anger management strategies, disseminating web resources that could help them deal with emotional and economic stressors that we think contribute to increased rates of violence. And we're working with the government not only to design and implement this intervention, which is an 8-week intervention, but also to evaluate it with a pre and post survey of these men. So this is the case in which having this partnership with them prior to the pandemic has given us access to a relatively large sample of men that have been identified as at risk of committing domestic violence, are also insiders with the ministry in that they've been recruited into IPV campaigns, and so participate for the most part in this kind of re-envisioned campaign, anti-violence campaign. And we're looking at pre-post comparisons because we have baseline data on risk factors and rates of violence from these households, but we're also trying to establish more of a causal association between lockdown measures and reported rates of violence by making use of geographic variation across the country in the degree of restrictions and economic impacts, which we can also measure with survey data. Next slide. And just to give you a sense of what Peru looks like, and I don't know exactly how this compares to other countries, but you do see there are various ways you can measure how much people have been restricted in terms of mobility by the lockdown. One way we did it is by asking them about the average days a week that they left the home to socialize or go shopping. We have a number of questions that are designed to measure it, and this is just one. Which shows that there's a fairly large distribution across households in our survey data. This is roughly 1,000 households that we've interviewed across the country, and many of whom don't seem to be restricted by these are all urban households, I should say. Many municipalities in which the pandemic was not either not in lockdown measures weren't enforced very strictly, probably because the health effects weren't measured to be large in those areas. And then you have several places in which people really go from socializing daily to not socializing at all. Sorry, there is just a second. I need to get my dog out of here. He just came in. Thanks. I'm used to putting my kids aside, but I have the dog. Next slide, please. And we also see from our survey data that the change in lockdown measures is related to reported rates of domestic conflict. So I'm going to just say right now that one of our biggest challenges, we've been working with men because the Ministry of Women shares our vision that some of the most effective IPV programming is, in theory, can target men, and because the perpetrators are the ones that we think might have the most control over this situation. Not that targeting resources to women doesn't matter also. Most GBV programming, at least public programming, is targeted to women, but we have worked hard with the Ministry of Women to try to come up with a set of programs that actually tries to address perpetrators, working on social norms around violence, and also working on things like anger management strategies to try to tackle the problem from that end. The issue with that population is that it is very hard elicit accurate reports of violence from perpetrators. And we know this because we have a sample of couples, of these 1,000 households encompasses a sample of couples that we've been working with, and we can measure violence reported by men and women. Now, we believe that women also underreport violence, but what is really striking is the difference in rates of report across the same couple in terms of exactly what's happened with physical violence in the household. And men report roughly a third or a fourth of the level of violence that their wives do. And so this is a problem in terms of evaluation, especially when you only have access to a male survey participant, which is especially the case when you are restricted to interviewing people over the phone. That's because in many parts of the world, only men have reliable access to phones. And it's also just riskier to try to interview women by phone in the household when you can't guarantee that they're alone. And so a big part of our research has been, what can we do to measure IPV as accurately as possible using high frequency survey data from men? And what we've come up with, our strategy right now is to use baseline data from men and women to generate a prediction algorithm based on a number of underlying variables that we do think men report accurately. Those to predict the weight of IPV. Then we extrapolate to the current setting in which right now we only have male reports of these variables and generate a predicted IPV rate. Next slide, please. This is what I just said. So the exercise, what we've done with that prediction algorithm is first to take those variables from our survey data with men and generate a prediction that matches the baseline report of women's experiences. And then the last number in this figure tells us what we predict, what our prediction algorithm tells us about the change in IPV pre and post pandemic. Essentially, what we're seeing is that in our relatively representative population of urban men across the country in Peru, the reported rates of IPV go from 23% of couples are reporting IPV in the past month to doubling to 53 or 54% right now. What we will do, so we validated that with baseline data, but not follow-up data. What we will do, are in the process now, is collecting data from women in the safest way possible. That is, women when they are alone and have access to their phone, to try to validate this prediction algorithm. But we think this is a very useful measure of IPV in a lot of settings. And so we're working carefully to try to come up with econometric methods of trying to extract information from male reports. And the information that we're extracting that predicts IPV well are things like number of arguments, the things that people actually are quite willing to talk about, stressors, how many disagreements, how happy are you in your relationship, how happy are you with your wife's behavior, what is your level of financial stress, and how is your anger, and direct questions about anger management. There's actually, it is not difficult to get people to talk about stress when they're under stress, but certainly behavior that they know to be wrong is much more likely to be underreported. Next slide, which I believe is our last.
I just want to interject, and I'm conscious of time, but yeah, I just wanted to let you know that there's the 8-minute mark. So
okay, you can go on to the next. I think I said all of this. So what we're doing now is, as I said, interviewing female partners to validate these measures so that we can generate a methodology on which to base IPV measures from male surveys, and augment this sample to continue to interview men and women to make use of more variation across the country. And finally, as I said, we will now that we have baseline measures of IPV post-pandemic, we'll begin, hopefully in a week or two, to actually implement this 8-week SMS intervention targeted to men, and conduct in 2 or 3 months of follow-up evaluation, which will give us some evidence of whether or not these kind of text-based, non-face-to-face IPV programs can be effective in reducing it. And that wraps it up.
Thank you so much. It's very interesting to hear about the new data and the results that are coming out right now. I want to quickly move over to Diana and ask you if you could talk through some of the World Bank's ongoing efforts to address gender-based violence during the pandemic, and if you have any lessons you want to share that might be useful to policymakers and practitioners. Over to you.
Thank you so much, and thank you for inviting me to the panel. I hope you can hear me. I'm getting some messaging on having an unstable connection, so I apologize in advance if this becomes choppy. So thank you for that question. It's a great question, and again, thank you for inviting me to this event. The World Bank is addressing the co-occurring pandemic of violence against women in multiple ways. As you all know, the World Bank is a very large institution working with client governments in low and middle income settings. And so we have a large portfolio of work that has started to address violence against women, increasing prevention and response interventions. And we are now embedding kind of what we are doing in COVID-19 response operations. But let me kind of walk you through several different items where we're, during the pandemic of COVID-19, addressing the pandemic of violence against women and girls. The first way is that we're continuing to support research. And so I'm not sure how many of you are familiar, but we partner with the Sexual Violence Research Initiative every year to give funding to innovative research across the globe in all 6 World Bank regions to address violence against women and girls in innovative ways. And so this year we did in July, launch the winners of the funding, the SVRI World Bank Award funding. And so we had to work with them to launch their research in the middle of a pandemic. And so we worked with them to kind of talk through the challenges, talk through some of the ways their research might be modified to capture some of the impacts of COVID-19 and integrate that into what they were going to do over the next 2 years. We also are conducting our own research, and as some of the panelists today have mentioned, Megan, Erica, both have mentioned research related to violence against women that the World Bank is collaborating in. I just want to check, can you hear me? Because everyone's frozen.
I can hear you perfectly. So I think it's good.
Okay, great, thank you. So we have gender innovation labs that conduct research on interventions and IPV and other forms of violence like child marriage and the effectiveness of those interventions. We're also conducting some research on continuity of services in the health sector. So we have the opportunity through some of our work to ask in around 17 countries how health services for sexual assault survivors might have been disrupted during the COVID-19 response. In addition, we're also looking at how those providing healthcare, frontline workers, the majority of whom we know are women, have experienced any form of violence either at work, on the way to work, or at home related to their involvement in the COVID-19 response. So we're conducting, several different of our teams are conducting research to continue to contribute to the conversation around violence against women and girls during the COVID-19 pandemic. We're also funding governments to evaluate and to move on to that next phase to evaluate what their policy response has been, if they've been effective, what populations they might have left behind. So that's another area of work that we have. We've also designed and provided guidance for our staff working on COVID-19 operations across the globe. And so we have specific guidance for them highlighting how they can address violence against women and girls during COVID-19 and also building in that response to strengthen systems overall that we know, as Felicia said, are lacking. in many, many countries around the world. So we have specific guidance highlighting specific violence against women and girls policy response that can be integrated in the health sector. We have specific guidance for social protection and economic empowerment and livelihood operations. And we have specific guidance that the IFC has produced for those working in the private sector. So we really are trying to highlight for our staff, not all violence against women and girls specialists, how they can include in the conversations with their clients and governments the importance of addressing the co-occurring pandemic of violence against women and girls. So we have these guidance notes available for all of our staff. Another thing we're doing is we're tracking policy response. And we're tracking policy response early on in the pandemic. And the reason we decided to track not only policy response, but also actions on the part of civil society is because governments were asking us what to do, but they also not only wanted our technical expertise, they also wanted to know what other governments were doing. So we started very early on, just, tracking all of the responses and then sharing them with governments, which became kind of a way to strengthen our conversation around the need to respond to violence against women and girls, and also that all countries were dealing with a perceived increase in violence against women and girls. In particular, we used this tracking as a way to design a webinar where we brought together governments from Peru, from Colombia, the city of Bogota, the Ministry of Women and Vulnerable Population in Peru, and the Ministry of Women and Vulnerable Population in Chile, to have a dialogue amongst themselves to talk about how they are responding to violence against women and girls. And so we created that connection and really saw within the webinar itself that the Peruvian government and the Chilean government kind of were already planning on next steps to emulate what each other had done and some of the connections that had been made. Chile was working in particular with Facebook to get some messaging out, to have women have access to remote services. And so Peru wanted to learn about that. So that started kind of an intergovernmental dialogue amongst our clients. And we've done that with the policy response tracking. And now that UNDP and UN Women have done something above and beyond what we're doing, we'll try to collaborate with them on how to continue to do this tracking and use it. So really focusing on not just tracking, but then how are we using and turning that data into action on the part of our client governments. And finally, and I think most importantly, we are seeing our operations in several sectors, such as health, social protection, environment, urban resilience and land, finance, creating opportunities to dedicate funding and create activities or complete components within broader COVID-19 response operations to prevent and respond to violence against women. And so we have operations that are integrating funding or are setting aside funding for awareness raising campaigns on how to access services remotely in a safe way. We're also making sure that the funding is there to strengthen the remote service provision and to have those providing services be given the technology and anything that they need for continuing to provide services during the pandemic within the constraints of social distancing and lockdown measures. We're also helping health systems strengthen and improve their data collection, their case management, their collection of medical legal evidence. So we're also using this to bring in technology and activities or components that will actually strengthen the health sector response beyond the pandemic. Because as Felicia said earlier, we know that this pandemic was there before, it will be here during the COVID-19 pandemic, and it will certainly be here after as well. So we're using it as an entry point to really strengthen systems that address violence against women and girls. We are doing also safeguarding of frontline health workers and giving governments funding to prioritize activities around that, using it again as an opportunity to strengthen health service response and increase training for healthcare providers. We're also providing emergency cash transfer, reworking requirements around benefits to enable those most vulnerable and women who have experienced violence against women and girls to access those social safety nets. So those are some things. Obviously, this is not my work. This is the work of hundreds of World Bank staff that have made a commitment to address COVID-19 and the co-occurring pandemic of violence against women and girls. And so the lessons that we've learned is really that there is an opportunity to have these conversations. One of the things that has been most helpful is to really share how other governments are doing this, what interventions they're implementing, and continuing to provide guidance to our staff and to help them through those initial conversations.
Thank you so much for that, Diana. I think this has been such an interesting first part of our webinar, listening to perspectives from research and from an implementer's perspective, the work that's been going on to address this important issue at this time. I want to move on to the next section of our webinar, and I'm going to ask some of our panelists some discussion questions that I have. I'll address each of these questions to each panelist, and then I'll open them up to the rest of the panel after the panelist has had the chance to respond. So I want to address my first question to Megan. You spoke when you were talking about CGD's work. You spoke about the need to move from thinking about how the pandemic is affecting violence against women to what we can do about it. So in your view and based on your research, what are some policy gaps that exist when it comes to evidence-based approaches to addressing gender-based violence? And what are some ways in which policy in this space can evolve based on the research and evidence that's available?
Thanks, Achara, and thanks everyone for really enlightening comments during the first part of this discussion. I think before I focus specifically on what the evidence says so far about effective policies and interventions that donors and governments should be prioritizing, I want to speak to the evidence that you started with and that Felicia, I think, really effectively underscored about the scale of the problem and the evidence that we've had for so long about the fact that 1 in 3 women worldwide is impacted in this way. So it's not only a colossal human rights violation, it's also, if those of us who are more focused on sort of development outcomes, not just the intrinsic human rights side of this, which should be enough room for action and justification for action already, we also have evidence that points to the impacts on women's health, education, right, their economic participation and productivity. So if we understand that 1 in 3 women is being impacted, I think it's hard to imagine that if another issue sort of fit those terms, we wouldn't have mobilized at scale and collectively sort of raised the financing to match the rhetoric, right? I mean, it's fantastic that the UN Secretary General came out and called this a shadow pandemic, and then other country governments signed on to a letter recognizing it as such. But I think, to date, we are still mostly stuck in that rhetorical place, and the financing has not caught up. So when we look, across OECD DAC donors, there is a policy marker that registers, violence against women focused financing. It pales in comparison, not to mention that gender focused financing writ large pales in comparison to other sectors and other issue areas that are prioritized. Another thing to note, from the financing perspective on that front is that in spite of the fact that we know that women at grassroots level, right, are delivering a lot of these services, women's rights organizations are not just advocating to make sure that this issue is front and center, they're also providing the psychosocial, the legal, the medical support. They're running domestic violence shelters often. These organizations receive less than 1% of donor financing that's going, through ODA channels. So I think first and foremost, where policy needs to catch up to the evidence is truly recognizing that scale of the problem that you and Felicia pointed to, and then matching it, right, with the financial prioritization. I loved what Felicia said about a diagonal approach, and I loved the examples that Deanna mentioned in terms of what the World Bank is doing, right, both in terms of dedicated action, but also making sure that across teams at the World Bank, there is guidance, there is an increased recognition of the need to consider this issue, whether through cash transfers or health system strengthening or what have you. I think my biggest sort of unanswered question that hopefully we get more clarity around, within the COVID context is how much, right? Is it 200 women being reached here and 50 women being reached there, or are we really taking these things seriously at scale? The second point I'll raise, in terms of sort of bridging that gap between evidence and policy is just to echo the point that Felicia raised around subnational government response as a real priority area. So excited to see, I mentioned the UNDP UN Women work. Deanna mentioned the tracking work that the World Bank is doing. We know UN University is also prioritizing this. To date, so far, we've got a lot of information at national level, but subnational governments are closer, right? And may in fact be better positioned to be doing the kind of work, providing the types of awareness raising services or support services to survivors to really make a difference. So how are we tracking what's happening there? And how are we prioritizing, connecting with and advising government officials, policymakers at that level? And then finally, to turn sort of most directly to the question you posed, I think in discussion already, we've talked about the ability of cash and in-kind food aid to ease those tensions, which I think can make a real difference. I think an interesting question for researchers going forward is around targeting. Should even adolescent girls be prioritized as the direct recipients of that aid and of that support? Do we see unintended consequences? There's been some debate around that in this space for a while that, maybe there'll be backlash in the household, maybe intra-household dynamics will be tense if women receive that report. I and others, have consistently pointed to the evidence that doesn't play out across the board, and that maybe targeting that sort of support directly to women increases their agency, their decision-making power relative to men within their households. We talked a bit about different social norms interventions. Could not agree more with Erica's points around engaging men, prioritizing sort of the shifts in their attitudes and behaviors towards their partners and other women and girls in their households. I think one thing that would be interesting to consider, especially in the context that we find ourselves in, socially distanced and relying on digital and virtual channels, is in addition to some of that more direct intervention that Erica mentioned in terms of SMS messaging, for example, just the role of the media, right? Whether it's telenovelas that Eliana La Ferreira and co-authors years ago pointed to in Brazil in terms of shifting gender norms, attitudes around fertility, other gender dynamics. How else can we think about at scale, fairly low cost and sort of virtually or digitally delivered interventions to be shifting those social norms? Because I think there is a really important role for that direct intervention at community level, face-to-face, household to household. But I also think that we could probably harness broader sort of at-scale media more to complement that as well. So I'll end there.
Great. Thanks so much, Megan. I just want to open that up to the panel. Does anybody else have any thoughts on some policy gaps in this space, specific ones, and ways in which policy could evolve in the space of gender-based violence? Okay, I think maybe in the interest of time, and given that I don't think there are other responses, I'll just move on to my next question for Felicia. I was wondering if you could talk, and this has come up several times in the context of the economic stresses of the pandemic. Can you talk a little bit more about the opportunities for social protection, like cash transfers, income support, etc., to mitigate the risks of GBV during this crisis, and more broadly?
Yes, of course, and many thanks. And one thing I also wanted to pick up on and just say, first of all, several of my colleagues on the commission were texting me saying, these interventions are amazing. We have to follow up with each of you. So thank you very much. It's amazing work. And one thing, just to pick up on Erica's work, I had to say, I wonder if we couldn't get that replicated in a number of countries, for sure in Latin America, even without any additional funding. So the sort of good side of not being able to travel and being able to do this sort of research is that it's much less expensive. And I know that we have groups of students who we could put onto this, certainly all over the region network. It would be, but building on what you've done, because you're actually laying the groundwork for how to do the analysis. So that could be, very interesting. If you're interested,
We'd love to follow on that. Yeah, let's keep
I
that
would
conversation
love to do that.
going.
For sure. And several others. And we're going to be calling Diana, I think, almost immediately following this webinar to ask for more information, help, and support, and to be able to participate with you on your work. Going to the specific question, though, around conditional cash transfers, I wanted to say a little bit of history. So I was, a resident in Mexico and was able to watch in real time how what was then Progresa and later became Oportunidades and then became Prospera, one of the sort of original CCT programs came forward, how it was incredibly well evaluated, the way it was thought through by true leader, Pepe Gomez de Leon, may he rest in peace, who's often not credited enough, I think, because he died shortly thereafter, for having founded these programs. But we've seen almost nothing that has been as heavily evaluated as these programs, and with demonstrated success in health, in nutrition, in education, and income generation, and other areas. They're also an incredible example of how you can implement a diagonal approach. And we've done this on other issues, like breast cancer, for example, where we could never think about developing, and we shouldn't, a parallel platform that reaches out to 95% of poor women. But we had, at that point, Oportunidades. So you can relatively easily embed if you're working in a policy environment that allows that to happen. And I wanted to share a little bit of the results on a social policy working paper series that's available through ECLAC, and give total credit to the three authors, in particular lead author Marika Blofield, Cecilia Gianbruno, and Fernando Figuera. And if I butchered your names, forgive me for that. That have done this great paper. It's called Policy Expansion in Compressed Time, Assessing the Speed, Breadth, and Sufficiency of Post-COVID-19 Social Protection Measures in 10 Latin American countries. And Marika shared with me and allowed me to share with you that, there's some very interesting news. So many of these countries implemented new CCT programs during the pandemic. And the list they have are Brazil, Chile, Colombia, Argentina, Peru, Bolivia, Ecuador, Costa Rica, and Uruguay. Some of these are not very deep in nature, so the transfers are quite small, like Bolivia, but others have been very impressive, particularly Brazil and Chile. And contrasting what we're seeing in the region, so Brazil has a very poor health system strategy for many reasons that we could talk about related to containing and managing COVID-19 and a lack of national leadership. But the opposite has been true on income support programs, which balances. And then we come back to the country that I know most about, again, Mexico. And unfortunately, Mexico almost doesn't appear in this work because Mexico decided to close down not only its health, social, and insurance program, Seguro Popular, but also what was then called Prospera in 2019. So whenever you close down programs of this nature, you generate a kind of chaos of transition, even if you've done the right thing. I would argue that that was not the right thing to do. But even if it were, it generates chaos. So unfortunately, they go into the pandemic having closed down very successful evaluated social protection programs. And from the research that's available, nothing has been implemented that could be considered a new CCT strategy to provide support. This, of course, maps onto a very deficient strategy on the public health and health system side that make me very worried about one of the largest countries in the region and the largest countries in the world, and one of the four that's contributed 50% of COVID deaths as of this week. Some good news, the program that I mentioned, again, this is Marika's work, and collaborating with individuals like Mariana Trundowski at CIDE. There are some highlights in the region, and the one that we've been able to find that we need to look at very closely is this program from Argentina called Acompañar, which is providing, according to what they're saying on the website, at least because we don't have evaluation data or even follow-up data yet, to survivors of gender-based violence, a cash transfer of a minimum wage for 6 months, which is longer than many other cash transfers, with very well thought through eligibility requirements, and it's compatible with other non-contributory cash transfers. If we can identify more programs like this, see how they're building off of what already exists, I think this is the opportunity, again, to think about Build Back Better. It's an example of a diagonal approach to policymaking, but what really worries me are countries that aren't doing this. And to build on something that I think Megan mentioned, what really worries me as well is where we're seeing primary healthcare programs devastated because they're responding to a COVID-19 pandemic. And that includes, obviously, sexual and reproductive health programs. You can't build those off of a CCT. And so we need to think very carefully about maintaining those programs in a primary care, community-based, clinic-based situation, or we're going to see a weakening of some of the platforms that can be most important for meeting the challenges of gender-based violence and supporting the needs of women and children.
Great. Thank you so much for that, Felicia. I'm going to move on to my next question to Erica, which is, I know you mentioned the SMS-based intervention that you were going to, that you're working with the ministry in Peru on. What are some things do you think practitioners can keep in mind based on the research when they're altering programs or introducing new elements during the pandemic? And if you can talk a little bit more about that as well. Thanks.
Yeah, I mean, I think there are a lot of differences. So what we're talking about in our setting is taking a face-to-face kind of social norms program in which men recruit peers and introduce ideas of masculinity and introduce notions of gender equality and respect for human life, and very kind of nuanced topics that are often new to the discussion table and in these peer groups or anyone's really. And I think there's a catering the message that makes these programs pretty effective in person and with peers. And obviously, you have to take that component away to some degree when you introduce a slightly more generic SMS. Disseminating, web-based information or talking about anger management in general for someone who might have a slightly different version of emotional dysregulation that doesn't show up in exactly the same triggers. Or so we're kind of, it's difficult. It's a little painful to take away that kind of individualized treatment of a targeted intervention. But I do think it's useful for scaling, and it is difficult in terms of especially resource intensity and labor intensity to implement peer-based interventions at scale. I do think there's a lot of promise in those, so I want to continue to work in that space. I think what we're moving towards, one very promising line of interventions, I think, kind of meets in the middle of these two, which is social media-based interventions that utilize platforms such as WhatsApp to recruit peer groups and have conversations, be slightly more tailored to that peer group, or in which individuals can, bring up their own concerns, their own individual situations, or pose questions, or gather as needed from that group. And we've been working in Peru also, although this is not off the ground yet, but we're working now with the IDB and the IRC, the International Refugee Committee, to implement a version of what Africa and Uganda and Liberia, I believe, was the first country, called the Real Man Challenge. I think it's going to have a different name in Latin America, but they are adapting these programs, which are WhatsApp-based social norms interventions that use a peer group and peer-trained individuals to moderate the WhatsApp group. And I think that, that's where it faces some of the challenges of the text-based interventions, and that you don't know exactly who's getting the message. You can't kind of control the messaging as well. I think when it's social media or when it's text, you don't know who's reading the text. You can't always guarantee that the person who's writing is the person you want to be speaking to. I mean, that can be true in a lot of, anytime you do things at scale. I think there is some messiness that way, but it's a little bit different with text-based and WhatsApp-based. But I think what's appealing about the peer group, is being able to replicate a little bit of that tailoring to the individual needs, because I do think violence, is very, the triggers of violence are very individual specific. And so it's been very challenging to try to come up with, important enough basic messaging that we think is also speaks to individuals. And we've received a lot of input from psychologists on this too, who have thought more carefully about how to frame those messages.
That's incredibly interesting. Thanks so much for sharing, Erica. I think it's been so interesting to hear about research, all the research that's being done from Megan, Felicia, and Erica, and the findings and the different things that are coming to light. We heard some things about cash transfers and the evidence that exists on them. I want to turn to Diana and ask about your experience of the process of using research to inform policy. So are there some lessons that you've learned in doing that? And what are some challenges from an implementer's perspective to using research to inform policy? Over to you.
Great, thanks. So I think some of the research that has existed pre-pandemic, pre-COVID-19, and some of the paper absolutely that Megan, Amber, Niati, and your other co-authors wrote early on helped us start the conversations, along with some of the emerging evidence around perceived increases in experiences of violence against women. So that was really helpful for us to have an entry point into these policy dialogues with our client governments in the context of broader COVID-19 support. So to say, and by the way, this should be part of your COVID-19 support, this should be funded and this should be prioritized. And that research was really essential to get that kind of, I would say, really enable us to take a part of those funding pots that were being channeled to governments to respond to the COVID-19 pandemic. I think one of the things that is more difficult for us, is in terms of what exact policy and intervention response, especially on the prevention side, because we do have a kind of a dearth of evidence on what would work in this specific pandemic. And then from what works previously, from interventions that work previously to address violence against women and girls, really kind of lacking some work around scalability and adaptability to different settings, right? So kind of seeing a bit of a gap there and an uneasiness when we say to governments, this was tested with positive results in the city, and with 800 participants, now scale it to all of Kenya, which is kind of what we propose. And so it's a leap of faith. And then also saying, and by the way, when you do this, why don't we evaluate it and kind of document how we're adapting it and stuff? Because we really want to figure out if this works and how exactly it works. So it's a delicate conversation to have, but we have governments that are completely on board with us. One of the difficulties, I think, that hasn't been mentioned but has also been really written about are around safety and ethical protocols for conducting research during this time, right? And working with governments, really thinking about training researchers on those ethical and safety requirements, and understanding that, service provision for those who are experiencing violence might already be overwhelmed, already be limited, or might not have existed prior to the pandemic anyway. And so how do we really kind of make sure that in the context of our research, we're not creating more harm? And to that end, a lot of the research and the papers around the ethics of collecting any data around violence against women and girls that have been set forward by Innocenti, UNICEF, DevX has had a wonderful series. We also read the work of the UNFPA office in East Asia Pacific, and we have, kind of grappled with this with the SBRI as our partners in the development marketplace. How do we really prioritize the safety and accessibility of women to services in the midst of COVID-19 pandemic, and at the same time continue our research to be able to better inform our clients on how to spend large amounts of money within projects. So, if you look across the bank's portfolio of resources that governments are lending for COVID-19 response, one example is $100 million for the Philippines as part of health system strengthening. So really thinking that we're getting small chunks within those large projects, but they can amount from anywhere to like 1 million to, $15 million. So if you think about it in that way, it's not small, and it is at a large scale. So thinking about what exactly should we recommend, thinking about scalability and adaptation from one setting to another, and really keeping women centered and their safety prioritized, and the ethics around conducting intervention research kind of fresh in our heads is something that we have to kind of juggle and a challenge in those discussions. But really, I would say the research before the pandemic and the analysis of how GBV has been impacted in other pandemics is still helping us in like the next phase when we're talking about the vaccinations and our support to potential vaccinations. So, we have evidence that in the Ebola crisis, vaccinations were exchanged for sex, right? So how are we preventing already and creating a conversation around, yes, we'll support vaccinations, but you have to be aware that this is one of the risks around, vaccinations, and that has to be addressed. So definitely super helpful. And I think both, I have to recognize here that the World Bank really looks at research and evidence produced externally. Although we do fund and produce internal evidence, we are dependent on the work of all of the panelists and many others who are not here with us today. And so it's important as a field to carry on and produce research even in the midst of COVID-19.
Okay, thank you so much for those insights, Diana. I'm going to move on to some audience questions since we have only about 12 minutes left. This one question we've gotten is related to the issues of underreporting that came up when Megan was talking, and also as something that Erica addressed, and also directly has to do with some of the results from Peru. So the question is, in South Africa, hotlines have shown less calls to GBV and emergency services. One theory is that victims are too close in proximity to perpetrators and are unable to call. And this seems different from the findings in Peru, where calls are spiking. Do you have any thoughts on why they might be spiking in some places and suppressed in others? So maybe I can address this to Erica if you want to give your thoughts on this, and then maybe Megan, you can pitch in as well, and then anyone else on the panel if you feel like you want to.
I can't say definitively, not knowing enough about the South African context, or even how it relates to Peru, but there's certainly a lot of reasons that could differ. I mean, I think another reason that hotline calls just might fall with the pandemic is because of economic insecurity is increasing a lot, and that's, I think, one of the big barriers to women reporting to officials. Making reports of violence is a fear of losing economic support, and when that becomes important, it's surprising that it might fall, or there's more reluctance. I think reporting, what they found in Peru is that it's really important to assure respondents that while they will be offered resources, that reporting is not going to directly lead to someone visiting their home or someone arresting their husband or someone making it, there are going to be many stages where they can still make that choice. And so that's important because you want to identify people at risk. You want people to feel like there's a safe entryway into interacting with a public official without automatically condemning someone or putting themselves at greater risk or putting themselves at risk of greater economic security. And so one of the factors could be that different ways of assuring people who are reporting of that control over that situation. I know that's proven to be important in terms of policy changes that have happened in different settings, including the US across states. But so that's one thing that comes to mind.
And I'll just add, one quick dimension as well to this underreporting question, and that is, how we apply it and understand it within the context of younger population. So adolescent girls, even younger, and boys as well, right? As we know that oftentimes reports are made on these individuals' behalf, right? Or even if they are making their own sort of reports, a lot of that historically tends to flow through school systems, so teachers, administrators, and how in the context of school closures and that not being a pathway for reporting, do particularly vulnerable, right? If we think about the intersection of age and gender, populations get reached, get recognized, get the support that they need. So that's one thing that we've been seeing from both the research that I referenced earlier and also in these research roundups we've been doing. Amber T and myself reported from shelters' perspectives, from service delivery and practitioners' perspectives, that they're seeing a real precipitous drop, a decline among children, especially in reports.
And if I can jump in for a minute, I mean, we are looking really at very short-term data, month to month. And so these aren't a steady time series in which we should draw, I think, any kind of conclusions yet. There are a few studies that are longitudinal. There's one that was published in The Lancet just a few weeks ago for Bangladesh, where you're actually looking at the same group of women. You have information from before a pandemic and you're asking them during pandemic. And that's somewhat more reliable. But we're looking at small numbers, volatile times, and many reasons why reporting could fluctuate up and down, including one that I don't think was mentioned, is that women are afraid of being in contact with others right now, because when you go to a clinic, you are at risk, feel at risk of getting COVID. So I don't think that we should try to draw conclusions off of these short run time series.
Okay, thank you so much to all three panelists there. I also have one question from the audience specifically for Diana. This is a question about the cash transfers to survivors that you mentioned. If you could talk a little bit more about that, and also some specific examples of programs promoted or supported by the World Bank and how they are implemented.
Sure. So thanks. Yeah. So the cash transfers, we're not targeting survivors particularly. We're broadening the categories of benefits and how these social transfers are delivered, and making sure that women who experience economic stress can have access to a cash transfer, emergency transfer, or an in-kind transfer. So really looking at kind of vulnerability around economic stress, increased economic stress, women who have lost their livelihoods opportunities because of all the lockdowns or changes to economic patterns that are a result of COVID-19. So thank you for that question, because I think it's important to mention that we're not kind of like signaling out women who've experienced violence as those recipients to cash transfers. And so we have several, different operations, and I'm just trying to pull up because I have an internal tracker as well. Again, I mentioned that this is a work across every region of the bank. I think we have work in every region except ECHA right now that is related to violence against women and girls. And so what we're doing is expanding our social safety net programming, and then where the opportunity lies, we're combining it with some social norms, messaging. We're I think it's in Malawi, I think. I'm not sure because I'm not part of these teams, but we have a cash transfer program that is a national cash transfer. And then we're creating kind of a couples training that will address violence against women and girls. And again, drawing from the evidence-based interventions we do have, we know that delivering those interventions through multiple modalities will have higher impact. And so it's really a combination of like in-person training with some social media, videos, potentially some theater. So it is a multi-component intervention. So that's kind of what we're doing. But the list of interventions is long in different countries. And I'm happy for you, whoever asked the question, to email me if you have specific countries that you're interested in. We can further discuss what we're doing in specific countries.
Sorry, I was muted right there, but thank you so much, Diana, and I hope, and thank you for the audience who submitted questions, and please do follow up if you feel like you want to learn more about this. So given that we have 4 more minutes left, I thought I'd just move on to some concluding remarks and, summarizing some of the thoughts some of the things that have been shared. But before that, I just wanted to open the floor to see if any of the panelists had any final remarks that, just to give you an opportunity to air them, if you had any final remarks that you wanted to add to this discussion.
Just one very quick, which is we've been speaking about the positive opportunities that we see from social interaction and communication online. But just again to highlight that it's a point of entry for predators that's so dangerous now and in the future for children and for women, and to think about what we can do to contain that too.
Absolutely. Thank you so much. Definitely a very important component. So just like, I'm sure we've had so many interesting things come up, and I'm sure I'm not going to be able to summarize or mention everything. But I think one of the big things that almost all of the speakers touched upon is that while it's now being called a shadow pandemic, gender-based violence has always been a huge issue and has always been a pandemic. So we are dealing with a dual pandemic at this point, but it has always been an issue, and it's important to talk about the scale of the problem as it's always been. There's also a need to strengthen systems that have already existed so they can be more effective during the crisis, and it's a diagonal approach to leveraging existing infrastructure to addressing this crisis at this time has also been talked about a lot, and I think it's very interesting. I think another interesting theme that came up was around underreporting, and how underreporting is an issue when it comes to measuring effects of programs could lead to some mixed effects. And of course, as Megan mentioned, it's important to move from how the pandemic is affecting violence against women to what we can do about it. There was also a lot of we spoke a lot about social protection and cash transfers, and how the economic stresses of the pandemic could be a pathway through which violence against women is increasing. Of course, a lot of speakers, Felicia, Megan, have highlighted sort of the evidence that exists on cash transfers and that they can be effective. And so they might be a promising approach, while of course it needs to be taken into account that there are possible these interventions might have adverse effects. We don't have that much evidence supporting that, but of course, like Diana mentioned, it's very important to ensure that the women the people that we're trying to reach through these interventions are safe in that process. I think a final theme that emerged is around gender norms and perceptions, and how they play an important role in the behaviors of individuals, especially men, and that sort of highlights the importance of engaging men as well. And although changing gender norms and perceptions is important, it's tricky. Erica talked a little bit about personalizing interventions as we pivot them and tailoring them to individuals, and given how complicated human beings are, it can be a tricky approach to take, but definitely it's definitely important to address these. I think, yeah, those are my key takeaways from today. I see, does anyone want to add anything? Did I see? Okay. It looked like I saw a raised hand in the panel, but I don't think so. I want to thank everyone so much for joining. This has been such a great discussion, and there's been so much learning. And thank you so much for taking the time. And I hope everyone watching got a lot out of this and is taking a lot away from it too. So thank you very much, and hope you all have a good rest of your day.